Amid global turmoil, war, environmental collapse, emerging epidemics, antimicrobial resistance, and social disorder, a deeper truth remains concealed behind Maya. The veil of illusion that shapes how humans perceive reality, authority, illness, and safety. Just over a century ago, medicine entered a new era of centralization. The 1910 Flexner Report, supported by the Carnegie Foundation and later reinforced by powerful philanthropic influence, transformed American medical education. Many medical schools closed or merged. Proprietary schools, irregular practitioners, herbalists, homoeopaths, midwives, and traditional community healers were pushed to the margins. A university-based, laboratory-led model of medicine became the dominant path to legitimacy. This model delivered remarkable progress. Scientific medicine provided safer surgery, improved obstetrics, anesthesia, vaccination programs, emergency care, intensive care, cancer treatment, and the capacity to treat infections that once caused millions of deaths. However, over time, healthcare also became centralized, costly, hospital-dependent, and professionally guarded. Ordinary families were gradually taught to distrust their own observations. Women, who had historically borne much of the family care burden, were often excluded from formal authority. Healthcare became a system people visited when frightened, rather than a form of wisdom they carried daily. Then came antibiotics. From the 1940s onwards, antibiotics became the invisible foundation of modern medicine. Surgery, childbirth, chemotherapy, transplants, intensive care, wounds, cuts, and bruises all subtly rely on our ability to prevent and control infection. Today, that foundation is cracking. Drug-resistant infections are rising faster than new antibiotics can be developed. The World Health Organization has warned that antimicrobial resistance is now one of the top global public health threats, and without coordinated action, the world may enter a post-antibiotic era in which common infections can again prove fatal. The solution is not fear. The solution is honesty, education, early intervention, and decentralized intelligence. This is where Pema Kiosk, powered by Dr. Maya AI, offers a new direction. Pema Kiosk does not replace doctors, it does not prescribe, it does not pretend that community guides are clinicians. Instead, it creates a women-led support system where trained Maya advocates assist families in describing symptoms clearly, understanding warning signs, using educational apps and videos, and deciding whether to visit a chemist, nurse, doctor, urgent care center, or hospital. This is not a return to unsafe, informal medicine. It is the next evolution of community health intelligence. I previously trained nurse practitioners and nurse prescribers. I taught junior doctors and nurses how to recognize patterns, listen to the patient's stories, and distinguish minor issues from serious dangers. Maya advocates can be trained in the same spirit, not to diagnose or prescribe, but to guide, educate, escalate, and protect. This also embodies a model of women's empowerment. For too long, healthcare authorities have been male-dominated and institution-centered. Pema Kiosk shifts part of the front line back into the community, led by women, mothers, daughters, and trained local advocates. These women can earn income, gain respect, support doctors, reduce unnecessary urgent care visits, and strengthen primary care infrastructure in villages and underserved communities. The financial model is transparent. 50% supports Dr. Maya Foundation, which maintains the AI, updates safety protocols, develops training, and safeguards the mission. 25% support the franchisee operating the kiosk. The remaining 25% supports ethical investors' expansion of funding. Payments are collected directly by the Pema Kiosk system and distributed digitally, reducing leakage, middlemen, and corruption. This is not merely a business model. It represents a social architecture. It provides income for mothers. It offers purpose to daughters. It results in better prepared patients for doctors. It delivers safer, early guidance to villages. It offers investors a transparent social impact pathway, and it enables India to pioneer a women-led, decentralized healthcare support network before the post-antibiotic era becomes a full humanitarian crisis. Even modern physics reminds us that reality is stranger than the surface world our senses perceive. The suffering of one family, one village, one infected child, or one neglected mother is never isolated. Sarvam Kalvidam Brahma. All this is indeed Brahman. If all life is connected, healthcare cannot remain confined inside hospitals alone. It must return to the home, the village, the mother, the daughter, the community, and the conscience of humanity. I'm asking you to launch a movement that makes women the first line of wisdom, safety, and dignity. This collaboration will make history.
Let us begin. Scan the code to join Dr. Maya AI and help us build a national example of safety and empowerment.
Thank you.